So good morning, everybody. Welcome to the October 18th, 2022 meeting of the Calvert County Board of Commissioners. At this time, I'd like to ask Pastor Joan Jones if she would give us an invocation, please.
Good morning.
Good morning.
Thank you for the opportunity to participate this morning. Let us pray. Eternal and all-wise God, we are humble and grateful this morning to be in your abiding presence. God, we are so grateful for those who are before us as the elected officers of this county. God, we thank you for this collaboration, this time of sharing, this time of thinking, of debating. God, we give you thanks for the wisdom, for the knowledge, and for the discernment that we know you have placed within them. And God, we pray that they will use it this morning to enhance the livelihood of this county. God, we pray that through your presence, through your guidance, and through your unseen hand, God, that the discussions will be comfortable, will be pleasant, and all will be done to your glory. In Jesus' name we do pray. Amen.
Amen. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Pastor Jones. We really appreciate you coming in today. Next item on the agenda is to approve the agenda. Are there any corrections or additions to the agenda as presented?
Make a motion to approve.
Second.
I have a motion and a second to approve the agenda as presented. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carried. So, public service announcements, I have a couple. We want to, again, express our sincere condolences to the family of Margaret Miller. Margaret was very active in our community, was the former Calvert Beacon CEO, used to attend all of our meetings. When I first started out, was always here, always saw around about. And once again, we just want to give our sincere condolences to the family. Today is the last day to register to vote in person, so if you have not registered yet and you want to vote in this upcoming general election, you must do so today. And on October the 13th, which was last week, was the U.S. Navy birthday. So being that we have a significant naval base in our community, I want to wish all those Navy sailors a wonderful, happy birthday. The Navy was established on October 13th, 1775. So for all those Navy guys out there, happy birthday. It's the last thing that I have. Our first item on the agenda is to convene as the Board of Health. Morning, Dr. Polsky.
Good morning. Do you need to make a motion?
Yes.
We do.
I'd like to make a motion, Mr. President, that we recess a meeting of the Board of County Commissioners and convene a meeting of the Calvert County Board of Health.
Second.
We don't have Commissioner Weems here today to keep us straight on motions.
I'll try to fill it.
So I'm going to have to ask my two colleagues
Come
to
back again next week.
make sure that we get
Well,
on track.
one of us is going to have, one of the two of us is going to have to make the motion, and one of the others.
That's right.
Yeah. So we do have to play together today.
So I have a motion that we adjourn as the Calvert County Board of Commissioners and we reconvene as the Calvert County Board of Health. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries. Now, Dr. Bolson.
All right.
Commissioner Weems, we miss you.
Yes. So, glad to be back, and want to let you all know, I know that you know Dr. Folsom. She will be joining me in giving part of the presentation today. Dr. Folsom is a family practitioner who's been in our county for a number of years, and has joined our health department right as COVID was starting.
Yeah.
And has just done yeoman's work, above and beyond. All right, before I get to my scripted slides, I'm sure most people at home and everybody in the room realizes we need to get our slides in a couple weeks early, and this was originally scheduled for 2 weeks ago, so there might be a couple updates along the way. One set of data that just came out on Friday was the update for overdose fatalities in each county around the state. did want to let you know that Calvert's overdose fatality rate is about half of the rate in our surrounding counties and less than half the rate for Maryland as a whole. So as we've talked about repeatedly over the last 7, 8, 9, 10 years, that we know that overdose deaths are not going away completely, and it is incumbent upon all of us to collectively pull together as a community to do what we can to minimize the impacts, help those that are ready to get help, and lots of prevention efforts. So that very significant improvement in overdose fatality rates in Calvert is in part because of the work we do with the health department, but very much a collective effort with agencies across the county, and we hope to keep all those efforts up as we go forward and further minimize overdose deaths. All right, I'm going to start out with COVID stuff, of course, and the purpose of this slide is not to get into dramatic detail, but just to show that vaccinations make a tremendous difference in outcomes with COVID. The lower line that's almost impossible to see because it's so low down on the slide represents the hospitalization rates for people who have been vaccinated. The first part of the line is solid. That's when the first 2 doses were available, and then it becomes dashed at a certain point when boosters were available. The upper, very jagged line is for people who have not been vaccinated. And you can see even in relatively calm times, like in June, which was when this slide was finalized by the CDC, that for people who were unvaccinated, they were about 4.5 times more likely to be hospitalized. During peaks of waves, whether Alpha, Delta, or Omicron, unvaccinated people were 10 to 12 times more likely to need to be hospitalized than people who were fully vaccinated. So as we head into what will almost certainly be another wave of COVID as we reach late fall and into the winter, really important for people to keep up on their vaccinations. When we take a look at deaths, for people with 1 booster, about 8 times less likely to die than people who are unvaccinated, and for people who have 2 boosters, or now sometimes 3, 14 times less likely to die than people who remain unvaccinated. The data out of Japan is really striking. 95% of the population of Japan have been fully vaccinated. Their per capita death rate is 9 times lower than in the U.S. And that's with a population that has a higher percentage of seniors. So 25% of Japan's population are seniors compared to 15% in the U.S. Those vaccination rates make a tremendous difference. I tried to make the best of my getting stuck at the top of the bridge one day, so a lovely view down the Patuxent.
Did you stop on the top of the bridge?
I was stuck. There was
Oh,
some kind of
stuck.
mess on the St. Mary side, and we were all just parked on the bridge. So fortunately, I don't have a fear of heights, as the bridge was slightly wobbling in the wind.
Slightly.
Slightly. It was a windy day.
Yes.
That's true.
So State Highway says.
I hope they're right. So along lines of vaccinations, I think almost everyone is aware that there are new vaccines out, the bivalent vaccines. So those are a combination of the original vaccine and a new component that targets the BA4, BA5 Omicron strains. And that's very important because we've seen with the last wave that more people who were vaccinated with the original vaccination were ending up getting sick. And we have seen since the spring, well, it says 99% on the slide of infections have been BA4, BA5. Again, in the time since I put the slide together, that's about 90% at current. But the bivalent vaccines specifically target the BA4, BA5. They have the identical spike protein. That's why I lumped them. They have other differences in the virus.
And you have that on hand?
Yes.
You
So
do.
we have it on hand. We've been vaccinating. I've gotten my bivalent vaccine already. Dr. Folsom's gotten her bivalent vaccine already. Everyone in my family has gotten their bivalent vaccine. And there are 2 important things about the bivalent vaccine. One is, and the slide up here, just to quickly explain, the bars on the left side is the original vaccine. Of those 5 bars in each cluster, the one to the far left is the original strain of virus, and then shows the beta, the delta, and then 2 different types of Omicron. So you can see with the original vaccine, really good antibody response against the original strain, pretty good against Beta and Delta, but not a great response against the Omicron strains. The next set over is the vaccine that was formulated only for Omicron, and you can see very good response to the Omicron strains and not very good responses to the original, the Beta or the Delta. And then the cluster on the far right is the combination of the original plus the Omicron, so the bivalent vaccine. And you can see across the board, very good responses, including even a better response against both Beta and Delta. So even though neither of those formulations were specifically targeting those, when you have two different strains in there, the body responds in a more malleable way to go after a wide variety. And we know that the HPV vaccine that has been out for 15, 20 years now also has a combination of HPV strains. And for adolescents who have gotten HPV vaccines, we've seen cancer rates of close to zero from those types of cancers as they get older because of this sort of pleomorphic or sort of malleable way that the immune system responds when you introduce different variants in. So if we end up with a new strain, and I mentioned we're down to about 90% with BA4, BA5, so the newest, the other 10% is BQ1. That is an offshoot of Omicron. It's very likely that this bivalent vaccine will give good response against that based on the data that we're seeing against these other strains. And if we end up with even a different variant in the winter, again, getting the bivalent strain is almost certainly going to give better protection than the original vaccine. And then, again, this slide's now a little bit dated because of the delay in the presentation. But there was also an emphasis by the CDC of getting vaccinated early. Don't wait until more waves come in. So they had 5 independent teams of U.S. epidemiologists taking a look at when would be best to encourage Americans to get vaccinated. And what they found is the earlier the better during the flu season or during the upcoming virus season. So they calculated that people getting vaccinated in September versus waiting until November would prevent about an additional 137,000 hospitalizations. And those teams ranged anywhere from 21,000 prevented hospitalizations as much as 250,000 and about 10,000 deaths prevented by doing earlier vaccination. So this is not compared to not getting vaccinated at all. This is getting vaccinated earlier rather than waiting and delaying. And then the other is they put a dollar sign on it, or a dollar figure on it. So earlier vaccination is projected to save about $75 to $100 billion in U.S. healthcare costs. And as Benjamin Franklin said, public health is public wealth. And this is a reminder to employers that they should be incentivizing their employees to get vaccinated both against COVID and against the flu, which we've seen, as we saw in Australia during their flu season 6 months ago. We're already seeing significant cases of the flu earlier than we typically see. In Australia, saw much more cases. So for employers, they have an economic incentive in addition to caring about their employees, making sure that they have a staff that can come in, not just come in to work, but come in and work productively.
So you
Yes.
mentioned flu.
Yeah.
Reason Commissioner Weems isn't here today is because his son has the flu and can't go to school. And apparently I hear it's running through the schools. Strain A. Is that the one that the flu shot is designed to protect against this year?
So flu shots in general, they protect against both type A and type B. There are two, and they have to guess ahead about 6 months or
That's
more.
why I asked, because
Right.
I heard
Yeah.
that all the time.
Right. So the flu vaccines are quadrivalent. There are 4 different types of flu strains in there. There are 2 type A's and 2 type B's that are injected in. And the question is, the 2 that they pre-selected for type A, how well are they going to match up against what's actually circulating? That we won't know for probably about a month to 2 to see as they start to actually take a look at the figures of who's getting infected and who isn't. But they do try to hedge on that by putting 2 strains of both A and 2 strains of B. And oftentimes we see a second wave of flu later in the year, like a B strain will later emerge. So for people who are getting vaccinated now or have already gotten vaccinated, they'll carry that protection for at least 4 to 6 months really strong. which at this point is going to get you through what's generally the harshest part of the flu season.
So do you have any numbers on how many students are out with the flu?
We don't specifically for the flu.
No. But I've spoken with some school nurses. Actually, we ran our flu clinic, our community flu clinic on Saturday at the 713 site. And our lead nurse is one of the school nurses, and we were talking about how it's all sorts of viruses. GI bugs, we're seeing flu A. They've actually seen some flu B, and of course, COVID still. So, and then some of the medical providers started seeing it much earlier than we would usually anticipate. I think my very first text from a medical provider was in late September, which is not usually when we see the first case, so.
And nationally, there have already been some high schools shut down because they've had over 50% of their students out sick.
Yeah.
Now, that may be a combination of flu and RSV and possibly one or two other viruses, but yeah, this is just part of the nature that very few people have been exposed to the flu in 3 years. And so circulating antibodies from just natural infection are essentially non-existent, and for people who don't get their vaccine, they're just going to be very, very susceptible, more so than they would be in a normal year.
Why would you say that that's the case? Why would you say that over the last 3 years, very few people have been exposed to the flu?
So, in partly because of these things,
Okay.
and in partly because people have been working remotely, people just have not been congregating. And so, we have very clear data that the number of flu infections over the past several years have been extremely small. We've seen almost no hospitalizations because of influenza, so plenty from COVID, but almost none. And people going to the hospital are tested routinely for both COVID and influenza. So we know we're not just overlooking it. The virus just hasn't been circulating. And this just underscores how much more transmissible COVID is than influenza. That the measures, keeping some relative distance, people to some degree wearing masks, has been doing a phenomenal job of keeping flu at bay. But COVID is so incredibly transmissible that we've seen some success, but not as much in preventing COVID from transmitting.
But I'm sorry, go ahead.
Oh, I was just gonna say, in terms of the school system, one of the things that I think we are all aware of is that most adults don't have as flexible amount of time with their time off. And there are some people who are sending in children potentially while they're infectious. Maybe they have mild symptoms. And so, I know that from the school nurses' perspective, that was one of the concerns. So just making sure people stay home when they're not feeling well, which is what a lot of people did very well during the early days of COVID. If they were feeling sick, they stayed home. We've kind of gotten out of that habit, I think, a little bit.
But I was wondering about the flu, if, people's immune system is designed, to the best of my knowledge, I'm not a doctor, I don't play one on TV, but people's immune system is designed to take small portions of an infection or a virus and it builds immunity to that, correct? Over time, like the flu,
To varying degrees. Different viruses, different bacteria evoke different degrees of response from the immune system, so it's certainly not a one-size-fits-all.
right. But if we spent a couple, 3 years of nobody being exposed to influenza, then like you said, everybody's influenza immune system would be reduced, is what I'm thinking.
If you're going only by natural immunity.
Right.
So the benefit is if people get vaccinated, then they don't have to work. You don't want to have the infection just to get over the infection in general. For all childhood immunizations, measles, mumps, rubella, the more that people are vaccinated, then they don't even have to fight off to get that protection, the infection. I don't know if that makes sense.
Yeah,
Yeah,
and
sorry.
you don't want to wait until a child has measles, you'd rather get them vaccinated.
Yeah.
Right,
Yeah.
I understand.
All right, well, keeping on my river theme, so different clouds, a tributary of the Potomac. And then I did want to take a moment to recognize our health department's geriatric and home visiting nurses who've done just a phenomenal job getting out to the homes of people who are homebound to vaccinate against COVID. Even though somebody may not be able to get out of their home, there are other people coming in and can bring the virus in, and these are people that have incredible vulnerability to severe infection if they should get infected. The chart on the left side shows vaccination needs have been met. And every identified person in our county who's needed vaccination, we've achieved that, and to a proportionally much higher number than in most other counties. So if we vaccinated at the same rate as Anne Arundel, that has a population about 6 times higher than ours, we would have only vaccinated about 65 homebound people, but we vaccinated over 300. And that is a tribute to our nurses working with the county's Department of Aging, with medical providers, with social service agencies to identify homebound people across the county so that we make sure that we can reach out and get people vaccinated. In addition, and other aspects, our infectious disease nurses at the health department have worked continually with nursing homes and with assisted living facilities to make sure that both their residents and their staff are up to date on their vaccinations. Our primary care providers have really just done a phenomenal job all through the pandemic in offering rapid testing, making sure that people who are identified with COVID, that their chronic diseases, whether it's diabetes, asthma, heart conditions, were managed early to keep them healthier and safer. And once antiviral medications became available, they were able to prescribe those very quickly because of the rapid testing they were doing in their offices. Our health department staff has also, I think, done a consistently good effort reaching out to religious congregations, to minority health organizations. And as a result, Calvert continues to have the lowest hospitalization rate of any county in our state. So when you take a look, if you're a Calvert resident, you're about 60% less likely to have ended up in the hospital because of COVID than the average resident across the state of Maryland. So I keep up on my vaccinations, not so much that I'm worried about getting hospitalized. Fortunately, I'm in relatively good overall health and I don't smoke. But the two things that motivate me to get vaccinated is, number one, I don't want to pass the virus on to somebody who may end up getting very sick or dying. And then the other is that we're all susceptible potentially to long COVID. So this slide shows that, this is done in June, that about 10% of Marylanders reported ongoing symptoms as a result of previous COVID infections. And you can see in states that have relatively low rates of vaccination that that percentage is about double. Those states have about 20% of adults reporting ongoing. This is not 20% of people with COVID, it's 20% of their entire population are reporting symptoms. And so long COVID are persistent symptoms, at least lasting for months. And for many people who got infected back in 2020, they're now 2 years in and still having health problems as a result of the initial infection. Studies have shown at least 5 to 10% of people infected will report ongoing symptoms. And in most studies, both in the U.S. and abroad, about 25 to 40% of infected people have ongoing symptoms. The more severe the initial infection, the more likely for people to have ongoing, but even those who had very, very mild initial infections are susceptible. And oftentimes their chronic symptoms are worse than their acute symptoms immediately after their infection. And these problems can occur at all age ranges, from relatively young children up through elderly. And in kids, we typically see fatigue, we see memory problems, concentration problems, and certainly for children trying to get their schoolwork done or concentrate in class or trying to get their homework done, these are not the kind of symptoms that are going to be, make it easy for them. And studies have consistently shown that for vaccinated people, they're about 5 times less likely to end up with long COVID symptoms than people who remain unvaccinated.
Doctor, a moment ago you said that one of the reasons why you have your vaccines, why you take them, is because that way you won't transmit it to somebody else.
Correct.
I was under the impression that CDC came out last year, early this year, and said that having the vaccine or not the vaccine has no bearing on whether or not you can still transmit it.
So,
It was my understanding that they said that even with the vaccines, you can still transmit.
so if you become infected, you are transmissible regardless of whether you've been vaccinated or not. But you're much less likely to ever get infected in the first place if you're vaccinated. So if I'm vaccinated and I had an identical twin who wasn't, then I would be much less likely to transmit to somebody else because I'm much less likely than my identical twin to ever pick up the virus in the first place. Okay. For long COVID, this is not an exhaustive list that I put on the side. You can see a little chart in the upper corner about all the organ systems that potentially can get impacted. But the most common symptoms, fatigue, shortness of breath, cough, and then those brain fog symptoms, and especially as you think about people who are getting up in years and may already have some cognitive challenges, that adding on to that.
Why are
with
you looking
memory-
at me when you say that?
I was looking at the flag behind you and getting inspiration. That people really need to think about, once you get infected, that's not the time. You need to make these decisions ahead of time. And then, this is my last slide, and I'll turn it over to Dr. Folsom, that there's a lot of concern among medical specialists, particularly cardiologists, endocrinologists, and neurologists, that we now have very good data that people who have COVID, when you take a look a year later, are more likely to have new onset diabetes, or if they had type 2 diabetes before they got COVID, they're much more likely to end up now requiring insulin. People who get COVID are much more likely to end up with either a heart attack or a stroke in the year after their infection than those who haven't had COVID. And this almost certainly goes back to that very, very inflammatory nature of this virus, which really distinguishes it from a lot of other viruses in the way it just instigates the body to overreact to the infection. So again, when people just look at, what's going to happen to me in the here and now, they also need to think about the consequences of these infections months later with long COVID symptoms, and potentially even a year or two later with major impacts that will be, once you become an insulin-dependent diabetic, there's no turning that back. So these are lifelong health problems that people will suffer, as a consequence. And then I guess my last slide. So in the spring, I had my rattlesnake up there. This very little guy showed up at my back door about 9 o'clock at night on the other side of the double pane glass. So to me, a little bit scarier. So just to remind people that rabies does happen in Maryland. We've had a couple of rabid animals in Calvert this year. And in the mid-Atlantic area, although we always think about bats with rabies, that by far the most prevalent carrier of rabies are raccoons. So be careful with putting too much bird feed out in the backyard, all these kind of things. You don't want raccoons near you, and stay away. They may look cute to some people, but they are in the weasel family, and they have fangs. That's it for me.
All right, and I want to thank you all for having me here. Thank you, Dr. Polsky, for inviting me. So as he mentioned, I saw patients here clinically in the county for a little over a decade before joining the health department. And what I'm going to focus on primarily today is some of the chronic disease metrics that affect the Calvert County as a whole. I did want to highlight a few endeavors that the health department does that maybe are a little less visible. So we enroll people for health insurance and medical assistance transportation. We run a full-fledged reproductive health clinic that provides all sorts of health care for individuals who are in need there. We obviously are a large group for our mental health and substance use care in the county. I'm primarily going to focus on that last thing, which is health promotion and education, which is really something that I know our team at Community Health is passionate about. The slides went a little out of order, so I'm going to go to this one next. This is the vision of sort of what community health looks like at Calvert County Health Department, so you can see all of the little circles underneath. Today I'm going to focus on the one right in the middle, which is the diabetes and prediabetes, as well as some of the tobacco prevention and cessation. We did create a minority health and health equity team this calendar year, and to highlight one of the things that we were able to accomplish by having that team, I'll go back one slide. I just wanted to highlight, we have created a program called Highway to Health. You heard that correct. It's a grant-funded project that'll last for the next 3 years, and the total is a little under $500,000. We launched it September 10th at Recovery Fest, and our goal is to really bring linkages to communities, going into neighborhoods with our van and providing people linkages to services that they might need. We're targeting areas where people might not be able to get out of their house, or maybe there's transportation issues, and we're also augmenting the services. So maybe there are doctor's offices that already provide some of these services, and we don't want to replace those, we just want to augment the services. We have been able to onboard more health professionals, a couple of nurses and a couple of outreach workers as a result of this grant. So we're very grateful to have it, and we're looking to improve the health one neighborhood at a time. So going forward, our health promotion endeavors are these specific things, but again, they sort of span many different facets. Usually we approach these things at fairs and expos and things like that. But there are other programs that we run that aren't really out there in the public's eye. So I want to talk briefly about prediabetes. So I look at this as a spectrum. Prediabetes in Calvert County likely affects about 27,000 individuals who are 18 and above, and about 7,000 who are 65 and above. And the reason that this is an estimate is because a large proportion of people who have prediabetes don't know they have it, okay? You're generally asymptomatic. You might have mild symptoms. You can get it detected on blood work, though, and there is a screening test that you can take either at the American Diabetes Association website or on our website. If you score high on that quiz, we encourage everyone, and we do this at expos and fairs. If you test high, you should talk with your medical provider about getting a blood screening test. The good news about prediabetes is you can do things to keep it from becoming diabetes, okay? So about 50% of all pre-diabetics can keep from becoming a diabetic just by making some lifestyle changes, a diet and exercise kind of changes. And we run a diabetes prevention program which aims to do that at the health department. It's a 24-session program. It is CDC approved, and the goals are listed there. Lose 5 to 7% of your body weight and exercise 150 minutes a week or more, which is the goal for pretty much every American. Okay, not many of us do it, but it is the goal. It's a 6-month initiation phase and a 6-month maintenance phase, so we want to make sure that when people lose the weight and exercise, that they can keep doing that in their life, okay, so they can keep scheduling it and planning it. You can register either by phone or online. And then just to put a little few stats here, so we run about 4 classes or 4 sessions a year because they are so long in nature. There's 24 sessions. And about 50% of our participants lose 7% of their weight or more, which is a pretty substantial number. We usually run them at the health department. However, this year, after a collaboration with Calvert Health and Calvert Internal Medicine Group, we've expanded to run 1 session down at Solomon's Island Medical Center. We heard that there was a need in that community to not have to come up to Prince Frederick. So we also have identified that 45% of the enrollees have high blood pressure. And so we are going to be creating and developing a Heart Healthy Ambassador program this next coming calendar year. As a continuum of that spectrum, if you haven't been successful at losing weight or exercising, you could become a diabetic. So about 8% of our adults have diabetes, and for the purposes of this particular discussion, I'm really talking about type 2 diabetes. So we're not talking about type 1, which typically affects younger adults or children. We're really focusing on type 2 diabetes here. So 23% of adults with diabetes don't know that they have it. So again, getting back to having the discussion with your provider. If you have a family history, if you're at risk because maybe you've gotten a little bit older, and I'm not focusing on any one person,
Thank
but
you.
that does increase our risk of developing diabetes over the years. So talk with your provider about that. We do offer diabetes classes, and diabetes classes at the health department, at the hospital, anywhere, are meant to be a supplement to what your medical team is already doing. So if you are placed on medicine or if you're asked to go see a registered dietitian, this is just something to augment this. So it's a 6-week class. It's 2.5 hours each session. We run 8 sessions a year. 4 are virtual, 4 are in person. We've collaborated with the Office on Aging for the in-person sessions, and you do not need to be a specific age to participate, except you need to be an adult, 18 and over. So if you are a 25-year-old and you just got diagnosed with diabetes, you can attend these classes, okay? Again, you can register online or by phone. And the goals are really to empower people to feel able to better manage their diabetes. So there's no specific number metrics here, like, lowering a blood sugar or anything like that. We really just want people to feel like they're confident in managing that. We get about 100% of respondents almost saying that they feel more confident. We do see that a large number of these participants have other chronic diseases, and the benefit of the Living Well with Diabetes self-management course is that you can use some of those techniques to self-manage your high blood pressure, your cholesterol, your asthma, other chronic medical conditions. I wanted to highlight the work that we're doing on the diabetes subcommittee, which many people may not know is even in existence. So the Community Health Improvement Roundtable, which is co-hosted by the hospital and the health department, we run a community health needs assessment. The hospital generally takes the lead on that. And in 2020, the Diabetes Action Plan was created at the state level. So the health needs assessment locally and the statewide Diabetes Action Plan actually looked at the same things, and we prioritized diabetes. So there's now a diabetes subcommittee. You can find information on healthycalvert.org. And you can see the number of groups that actually participate in that diabetes subcommittee. We meet once monthly for that. If people are interested in participating in either the roundtable or the subcommittee, I ask them kindly to go to Healthy Calvert, see how they can join. We're actively looking for people, community organizations to come on board and help us with these initiatives. As a part of that subcommittee, we've created a couple of resource guides. The very first one is an interactive activity map that we created. So it outlines places that people can walk or do physical activity in our county. You can click on a specific thing. It'll tell you if it's handicapped accessible, if there's food nearby, if it's stroller, if there's parking, those sorts of things. So we've tried to make it as thorough as possible for that interactive map. And we also created a printed resource guide for known diabetics or for people who are looking to prevent diabetes. You can pick these up at the health department, the hospital. You can see them at fairs and expos, but they're in print format, and we also have it a virtual link. Last but certainly not least, we have to talk about tobacco, of course, because it is really a major chronic condition for so many people, not only in this county, but state and nationwide. Currently, our rate is at about 14%, which equals roughly 8,500 active smokers who are adults in this county. I really wanted to highlight this because we run the tobacco cessation program. So if people want to quit, if you're interested in quitting, if you've been told by a medical provider that it's important that you quit, we're here to help. 8 sessions, 8 weeks in duration each. We also provide cost-free tobacco cessation medicines, patches, lozenges, which can help people. We have about a 30% quit rate, which many people would scoff at, but actually that's quite a good quit rate for tobacco. Most adults need about 7 attempts before they'll actually come to finally quitting, and fewer than 1 in 10 adult cigarette smokers will quit each year. So it's quite a good quit rate. As Dr. Polsky mentioned, we were initially supposed to be presenting a little earlier. We did just have a class start October 13th. Our next ones will start in January. If you want to sign up, you can obviously call us at the health department. Remember that tobacco increases the risks of many types of cancers, vascular disease, blood clots, and it can worsen your diabetes control. So if you are a diabetic, you don't want to be a smoker. November 17th is the Great American Smokeout. It is the best time to come by the health department if you're just looking for some basic information. Jane will be in the main lobby to help tell people about how to quit smoking. And we have heard loud and clear from the schools, my colleagues in medicine, that vaping is at an all-time high for our youth. Vaping products look like USB drives, so you cannot sometimes tell the difference between what kids are holding. And we really want to make sure that we are preventing kids from getting into tobacco use. So the school system has partnered with us, along with the Calvert Health Wellness team, to do expos and fairs and lunch and learns. And so we're hoping that parents and kids alike will be more vigilant about their kids getting into vaping. We do have a contract or a working partnership with a pulmonologist at Hopkins who will give us advice. If there's a kid that's actually vaping or smoking who really wants to quit or needs to quit, and they want to come to us, we actually call that physician up at Hopkins and get his input as to how we can best serve the youth in our community when we're trying to get them off of vaping or tobacco products. And then I just threw in a few data sets that I pulled from our teams at the health department. So just a couple of highlights. We've vaccinated against childhood immunizations for 125 low-income or uninsured children. We've had over 480 investigations for rabies in the last year. We obviously do food service and pool and inspections. And then just to highlight, we also do, because Breast Cancer Awareness Month is this month, we do offer colon, lung, and breast cancer screening for people who are uninsured or underinsured at no cost. So if they are interested, please have them contact the health department so that we can get them signed up to get breast cancer screening.
I'm going to jump in to clarify one thing.
Yeah.
So we've not had 481 cases of rabies.
No.
Just
I
want to
was
make
just
sure
going to
everybody's
ask,
clear.
No.
how many cases of rabies did you find out of 481?
No, but those
So
are, those,
that shows the number of reports we get for bats in people's homes.
Yep.
Raccoons tangling with dogs in the backyard,
Yes,
just
yes.
a whole variety.
Foxes.
of-
How many of
Foxes.
those 481 were confirmed?
Two
So
were
two.
positive.
Yeah.
So
But
two,
again,
okay.
this is a 100% fatal disease, and you never want, you want to overlook even one.
Yeah.
Because that potentially means that someone's going to die if you
So
don't
each
investigate.
report is an investigation.
Right,
Sorry. So
Right.
that's what that means.
So, just for clarification, there was not 2 human fatalities. You said it was 100%
These
fatal.
are yeah, so these are 2 animal cases.
Right,
Right.
okay.
Yes.
But that's.
100% fatal to the animal.
Right, understood. Understood.
So,
It is not
and that's
100%
important
fatal to
because
humans,
in those
correct?
cases, any human contact, we need to make sure that we get those people vaccinated
Vaccinated.
because the vaccinations are 100% effective.
Protective.
Yeah,
Okay.
against
Are we still talking about rabies or?
rabies.
Okay,
So
there's no
so
vaccination for humans for rabies, correct?
There is.
There is.
Yeah.
Yep.
Okay.
So you can either get it, if you're in a high-risk situation, like a veterinarian office, you
Right.
get vaccinated before you go into practice.
Okay.
But obviously, if let's say I get bit by a stray dog, I'm gonna start that vaccination series right away to keep myself from getting rabies.
Okay.
Yeah.
Not to beat
All
it
right,
to death,
but it is
there
not
are-
100% fatal to humans.
If it's untreated, it is
Yeah.
100% fatal.
Yeah.
Untreated.
Untreated.
Yeah.
If you treat it,
Correct.
so
I'm
treatment.
just trying to, because I just
So
want
Yes.
to
all-
make sure people
all the
didn't
staff
hear that it's
at
100%
the
fatal.
county's animal shelter are offered pre-vaccination so that if they get scratched or bitten, that they have that protection already on board. They get a supplemental vaccination afterwards, just as a precaution. For people who are completely unvaccinated, they get an immune globulin shot, which immediately puts antibodies into their system, and then they get a series of vaccinations to trigger their own immune system to finish off any virus that may have escaped the immune globulin. So it's a pretty extensive treatment regimen, and again, when it's followed through properly, it's 100% effective.
And that's all I had. Any questions at all?
Yes. I'm glad I heard you touch on influenza earlier, that there wasn't anything in the presentation
Yeah.
specifically on influenza, and I understand that influenza is just as problematic as COVID at times. Easier spread or not, whatever. We're looking at it more so this year than last year. I didn't see anything in here, so thank you for bringing it up and mentioning it. The flu vaccines are out there, so.
Yes.
I didn't see anything, and when you were talking about the functionalities of the community health,
Yeah.
nowhere in there did it touch on page 20, or slide 21, I think.
Uh-huh.
It didn't touch on something that I think was that hits home a lot more. We've got a major fentanyl issue in this country. And we've got major issues with people overdosing and everything else, and it's my understanding that that's one of the leading causes of hospitalizations or deaths, accidental hospitalizations or deaths in the country.
For overdoses.
For overdoses and whatnot, and I'm sure you guys are working on stuff on that, but I just didn't see anything in the presentations.
So we are time limited, and we always have to pick and choose. So
Right.
and if you look at, I think, any one of my fall presentations in years past, influenza always gets at least 3 slides.
Okay,
But I wanted to give time to talk about chronic disease management, which is also extremely important. When you take a look, what are the 2 leading causes of death? It's cancer and heart disease. We oftentimes prioritize things that are right at that moment, and we forget the broader picture of things that impact people's health. So I wanted to give Dr. Folsom time to talk about any programs that she works on there. As far as fentanyl, and again, I would guess that probably 80% of the presentations that I've given over the past decade, substance use has been prominently featured. And again, it was just a decision of what I wanted to allocate time for today. I did mention at the beginning that overdose deaths in Calvert are significantly half the rate
Right.
of surrounding counties, and that this is truly a multi-agency effort. Now, our health department is the largest provider of behavioral health care by far in our county, so we do play an outsized role, both in terms of individual treatment and therapy to people in the county, but also with outreach programs. And we partner with the jail to make sure that everyone who comes in is screened for both mental health and substance use problems, that we do our best to link those people not only with services while they're incarcerated, but also as they transition back out into the community. We have a program for pregnant and postpartum women. We have behavioral health therapists in our local schools, everywhere from elementary up through high school. So, there are efforts both in prevention, and I look at those, especially in elementary and middle school, as substance use prevention. If you can help children and early adolescents deal with anxiety problems and depression problems when they're young, they are much less likely to turn to substance use as they hit high school to deal with their unresolved emotional problems. And then we get into things like domestic violence and all the other sort of outspurs that both trigger substance use and then exacerbate. So, I'm more than happy to come back another day and talk for as long as you would like me to about our programs.
I just wanted people
Yeah.
out there to be, I believe it was last month or this month was overdose awareness.
This month.
And being this month overdose
Yeah.
awareness, I just wanted
Yes.
to drive the point home while you guys are here
Yes.
that you
Yeah.
guys are
Yes.
reachable for the public to come out to. Even though you didn't have it on one of the
Yeah.
slides or
Right.
anything like that, you guys are available. You guys can help out in any way, shape, or form on that.
And we thank you for that. And
Yeah.
I will say that at our health department, every day is Overdose Awareness Day.
Right.
Yeah.
I realize there's special, weeks and months that are recognized nationally, but, we're continually training people on uses of naloxone. And we have staff that go out into the field to work with people. So this is a day in and day out, literally 7-day-a-week effort that we have embarked on years ago and will continue going forward.
Thank you.
And I'll just put a plug in. We do offer Narcan training for people. So if people are interested in having Narcan at their, disposal to use, if they have maybe a loved one who may be using substances or they just want to have it with them. My 17-year-old got Narcan trained this summer when he was, not really doing much of anything. And I'm Narcan trained, so you can just carry it in your pocketbook or in your bag, and then you can have it available if you find someone who might be having an overdose situation. And it reverses the effects of an opiate overdose, so.
And
Yeah.
one last question.
Yeah.
On the tobacco cessation
Yeah.
classes, seeing how next month, I believe that there's a bill statewide that would legalize recreational use of marijuana. If somebody has an addiction to marijuana, can they also attend the tobacco? Will that become a tobacco and marijuana cessation program or just tobacco?
That's a great question. I don't know that
So
we've discussed.
we already have programs within our behavioral health unit for people who, whether it's alcohol, whether it's marijuana, regardless of what the substance is that they feel that they've either lost control over their use or they just don't want to use it anymore. And so those services will continue. I think one of the questions, presuming that ballot measure gets approved, which is more likely than not, is will there be additional resources coming down the pike? There's going to be tax revenue off of those sales. How is the state going to use those tax revenues? Will we have further funding to help with those cessation efforts, whether it's marijuana or other substances?
That's a good question, though.
So, it's a segue on my list. So, is there any research on smoking marijuana and health effects or risks to that?
Yes.
So I guess I'll start out and then turn it over to Dr. Folsom, that research has always been hampered by a federal ban on how federal dollars can be used to research. So we are decades behind where we should be in terms of understanding how it impacts cancer rates, how it impacts emphysema, and cognitive functions as well. And so it's very clear that people who smoke marijuana, just like with tobacco, the longer they smoke and the more they smoke per day, the worse their their lungs are. They can develop emphysema, all the problems you can see with tobacco use. Another variable is that the potency of marijuana has increased dramatically over the last 30, 40 years. And so we are seeing more psychoactive impacts, meaning that for some people, as potent as things are right now, that they're actually having psychotic episodes, which was rare if you go back in the 70s or 80s. And so research has been hampered nationally, and what we had started to learn decades ago doesn't necessarily apply, because it's like, I'll use alcohol as an example. If the only thing available was beer, and then all of a sudden you had distilled spirits like vodka, and the difference in how quickly you can become incapacitated is dramatic, and how it affects brain function in general. So we still have a lot to learn. We worry quite a bit about the impacts during pregnancy, because anything that goes to a person's brain goes through the placenta and goes to the fetus. And we know that the cannabinoid receptors, so THC, the chemical that causes people to feel the way they do when they use marijuana, that's one type of cannabinoid. There are multiple types of cannabinoids in marijuana. Some of those also have impacts on our immune system, and we have really rudimentary understandings of how that may impact long term. And when you're putting those substances into a developing fetus's body, both for the brain formation and for immune system development, the research just isn't there. So the concern is there, but actually being able to say categorically these are the outcomes, we still have a lot to do.
And that's regardless of whether you smoke it or just ingest it, right?
So smoking clearly is worse for lung. People who use edibles or tinctures where they're ingesting it, there's not going to be the direct impact on the lungs, but as far as impact on the brain, it's going to be identical either way.
Those other impacts are just related to the THC itself, not necessarily
Correct.
inhalation.
The route of
Right. But nobody wants to talk about
And the
that.
dozens of other chemicals that, again, we don't understand well.
So it's safe to say it's not safe.
Well, it's certainly not. There are certainly health hazards
Yes.
with using it, and it's like everything else that in alcohol you can put in the same exact category. That there are less responsible ways to use alcohol, and I think that people need to have the same outlook with marijuana as they do with alcohol use.
One of the concerns from that specialist up at Hopkins regarding the vaping epidemic is that kids can get their hands on vape products that contain THC. So in a developing body, developing brain, you're really looking at, what are the long-term ramifications? And we won't really know that a ton until we get out of this first little bit of vaping. But yeah, that's a big concern.
My last question is, I hear all the time that in Calvert County, we have the highest rate of breast cancer of anywhere per capita in this country. So it's,
I'm not aware that that's true. We do have a higher percentage than the state as a whole, but it's not.
okay, so we have a higher rate than anywhere
do
else
have a
in the
higher
state.
No, not anywhere
Oh.
else in the state, but we have a higher rate than average for the state.
Yeah.
I haven't, numbers have been slow coming out recently because the epidemiologists are devoting so much time to COVID that we're getting delays on cancer. So this has been the case for well over a decade. It defies the way that we typically think of who is susceptible to breast cancer, and I've had discussions with the epidemiologists at state level looking for ways that we can figure out why. So we looked at geographic areas. There's a nuclear plant in our county. There are Navy sites where chemicals have been used. But we looked very carefully for any kind of clustering, and there is no geographic clustering. So there's no increased rate around the nuclear plant. There's no increased rate around those Navy facilities. We took a look every different way you could parse and could not find a trace back to say this is why. I don't have a good answer for you. I wish I did. Our mammography rate is at least as good, a little bit better than average compared across the state. And so this is just one of those either waiting for the rate to fall or for something to emerge that we can then actively target and try to make better.
And I'm just gonna say, I mean, this is, obviously it's the health department's presentation, but with the hospital partnering with Duke as a Duke affiliate, I know that there are dollars that are put into different things. I'm not privy to that, but I know that there's a potential for if we have a large university type setting, if there's questions that need to be asked, maybe that will be a resource that we can utilize down the line.
Right, and I think that that's a tremendous partnership, and there are gonna be great benefits in the future because of that partnership. And somebody, if that's true, needs to find out why.
Yeah.
Because as you know, the assumption is it's the nuclear power plant, or it's groundwater.
It's water, yeah.
It's
I-
one of those two usually that people like to attribute it to.
Yes, and I think the partnership will benefit many individuals in our community if they're interested in trials, because there will be a straightforward path to that, from what I understand, to getting to those trials.
But hopefully as they build some history,
Yeah,
they'll get a handle
they
on.
can figure it out, yeah,
They'll figure it out.
yeah.
I mean, we look for indirect markers that could attribute to certain genetic differences here.
Yeah.
So like over in St. Mary's, there's a significant Amish population, and there are certain metabolic diseases that are more common there. So typically, when you have a genetic component to a cancer, you see cases at an earlier age, and you see more severe disease progression. But those patterns did not emerge either. So again, we took a look for, along with the, again, epidemiologists up at state, we took a look at everything that we could think to parse out. The number of cases per year is relatively small, and that also makes it more difficult to study, because when you have small populations, if there was sort of a hidden variable, you may not have enough data to really see that clearly.
Hopefully we will.
Fingers crossed.
Yeah.
Any questions?
You want a motion?
I think we're done. Thank you for your report.
Our
Okay.
pleasure.
Yes.
Thank you.
You have a motion for me?
I do, Mr. President. I'd like to make a motion that we adjourn the meeting of the Calvert County Board of Health and reconvene as the Board of County Commissioners, please.
Second.
I have a motion and a second that we adjourn as Calvert County Board of Health and we reconvene as the Calvert County Board of Commissioners. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you all. Have a great day.
Thank you, gentlemen.
Thank you.
So the next item on the agenda is appointments.
Award.
Don't have Linda, so
Yes.
you doing them?
Yes, sir, I am.
All right.
Award is prior to appointments.
Right.
Excuse me?
You have an award.
Award. Lisa.
Well, yeah, but he didn't show up.
Oh, he's not here?
Yeah.
So I guess we can announce it.
Yes.
So this month, the employee of the month, Mr. Ray Hutchins, is camera shy.
Yes, he's not here today. He was not able to make it. I'm
No,
Victoria
no, no, we're
Bosher.
gonna tell the truth.
What's that?
We couldn't drag him in here with a team of mules. He said he
I-
was not getting in
I
front of the
tried my
camera.
best. I did work with Ray when I was inspections and permits, so I did shoot him a little message to say, I am the one presenting your award, thinking it might butter him up. But if that couldn't get him, I don't know what could. So
The good news, he's so dedicated, he's out doing his job.
exactly. And the even better news is you guys get me instead. So.
That is good news.
Yes. For those of you who don't know, I'm Tori Boschert. I'm the Recreation Coordinator for the Central District of Parks and Recreation, and I'm also a representative of the Employees Recognition Committee. And today I am presenting the award for, as some of you have heard, the September 2022 Employee of the Month, who is Ray Hutchins in the Department of Public Works. Ray is a grading inspector, and he was nominated on actions that improve the county's public image. So I will read to you the email that was sent in, which I believe was the catalyst for his nomination. The email was sent by Mrs. Marquez in June, and it says, I had to take the time to send you this message regarding the outstanding treatment my family continues to receive from Wayne and Ray. All I can think is wow and say thank you. These two inspectors have gone above and beyond responding to our serious concerns regarding my father-in-law, Arthur Marquez's yard. My father-in-law, Arthur, is almost 90 years old and has been extremely stressed and upset due to the new construction going on next door, ruining his yard by standing water and mud. The condition of his yard is a mess, but Ray and Wayne are working hard making sure a solution is found before it gets even worse. My father-in-law has lived in Calvert all his life, was a tobacco farmer along with his late wife, and as well as my husband, his son, Timmy, until they took the buyout. His house and surrounding 52 acres is all his and my husband's. The new house was the only lot they did not own, as it was his cousin's who passed away a few years back, and his grandson is now building a new house. My father-in-law does not know this young man, even though they are related, but was very upset to see anything built next to him after decades of nothing there. As that was not bad enough, the new construction has caused him severe anxiety and stress, making his beautiful lawn a mud mess, creeping closer and closer to his well and basement, making grass cutting in that area impossible and ruining his lawn. He asked me to contact the county with his concerns and to please speak to my father-in-law in person, and last Friday, Ray did just that and calmed him down. Ray even went as far as to get a shovel out of his truck and dug the culvert that was filled with muddy water and sediment. Both Wayne and Ray are staying in constant contact with myself in this situation. I cannot thank them enough. Their work ethic exceeds far beyond any county employee I have ever spoken with. Please relay my family's sincere appreciation for the outstanding service they are providing a lifelong Calvert resident and retired tobacco farmer. His health and happiness are his son and my utmost concern. And I would like to also echo the sentiments. I worked with Ray for almost 3 years, and although we were not co-workers in the same office, he was right across the hall, and I know if there was ever a customer that called and was having any issues with any type of grading or sediment or whatever the case may be, I could call Ray and he would take care of it. He would deal with any customers that might have been a little unruly and taking it out on us in the office that had nothing to do with it. So Ray is just overall a good person, and I'm very happy and excited for him that he was nominated. And I am sad that he chose not to be here today, but I'm really happy that he's finally getting recognized because it is much deserved. I do believe I saw his director here. Carrie, would you like to come up and say anything? And that'll be it for me. Thank you all.
Thank you.
Just want to say Ray is one of our guys that we can lean on, and his standard performance is what is without a doubt what we like to model ourselves after in the public works area. So really glad that he's on our team, and we really appreciate the effort that he puts forth. I'd like to thank him for his effort, and he's just one of those guys that just keeps plugging along day after day, and we appreciate his effort.
Do you want to accept his plaque on his behalf?
Well, I'll take his plaque. Somebody else can deliver him the money, so don't think that.
We're debating if we're going to let him have the check. But Ray is former Commissioner Hutchins' nephew. Ray's a good Calvert County native and takes very seriously in protecting Calvert County's environmental interests. So
Yes, sir.
if you want to come up, Commissioner Gadaway, you want to give him a plaque, and we'll
But I'm not giving him the money.
take a picture. Maybe we can Photoshop Ray into the picture.
Anything's possible.
All right, we're gonna leave a open space, and we're gonna hold this up in between us, so we can Photoshop him in. Somebody will be able to do that. Okay.
Here we go. 1, 2, 3. Awesome.
Now, there's no money in that, so you can take it, and we'll figure out another way to get him the check. Thank you.
Thank you very much. Now we can do appointments.
Good morning, Commissioners. We have several appointments up for today. First on the list is going to be for Economic Development Authority, and staff is recommending that you reappoint Don Belinsky, and one vacancy will remain after that requested action.
Mr. President. I'll second.
Have a motion and a second that we reappoint Dawn Belinsky to the Economic Development Authority. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries.
Up next, we have Board of Appeals, and staff is recommending that you reappoint Daniel Baker as a member, and Marcia Claggett as the first alternate of the Board of Appeals. One vacancy will remain after that requested action for that second alternate position.
So moved.
Second.
Have a motion and a second that we reappoint Daniel Baker Jr. and that we reappoint Marcia Claggett as the alternate. Any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Motion carries.
Next up, you have Environmental Commission, and staff is recommending that you reappoint James Levin and appoint David Campbell to the commission. 3 vacancies will remain after that requested action.
So moved.
Second.
Have a motion and a second that we reappoint Jim Levin as chair of the Environmental Commission and that we appoint David Campbell as the District 1 representative. Any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Motion carries.
Next up, we have a Historic District Commission, and staff is recommending that you reappoint Michael Kent to the Historic District Commission, at which time you'll have no vacancies remaining after that action.
So moved.
Second.
Have a motion and a second that we reappoint Michael Kent to the Historic District Commission. Any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Next up, you
Motion
have,
carries.
next up, you have Building Board of Calvert County, and staff is recommending that you reappoint Dale Weems to the Building Board of Calvert County, at which time you will have no vacancies remaining after that requested action.
So moved.
Second.
A motion and a second that we reappoint Dale Weems to the Building Board of Calvert County. Any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Opposed, motion carries.
All right, and last up, we have the Employee Recognition Committee, and staff is recommending that you appoint Laura Cole, Beth Reimer, and Rachel Distel to the Employee Recognition Committee, at which time you will have no vacancies remaining after that requested action.
So moved.
Second.
A motion and a second that we appoint Laura Cole, Beth Reimer, Rachel Distel to the Employee Recognition Committee. Any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Is that it?
That is it. Thank you, Commissioners.
Very good. So the next item on the agenda is consent. And we have item 1, Department of Public Works Mutual Aid Agreement between the Commandant Naval District, Washington, and Calvert Emergency Services. Item 2, Department of Community Resources, Public Transportation, the FY 2023 Operating Grant Agreement. Item 3, Department of Public Safety Tower and Ground Space Utilization MOU between Charles County and Calvert County. Item 4, Department of Public Works First Lease Amendment for the Southern Library. Item 5, Department of Community Resources Local Behavioral Health Advisory Council Resolution. Is there any objection to any of the items on the consent agenda? Hearing none, those items will be adopted as presented. Next item on the agenda is a presentation by Department of Public Works. Morning.
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 James Erner, Deputy Director of Enterprise Funds. I have with me Chris and Jeff from USGS.
Morning.
Morning, Commissioners.
Morning.
My name is Chris Hall. I'm Division Chief of Water and Sewer. We are here, I'll just read this. The Department of Public Works Water and Sewer Division and the United States Geological Survey have had a joint funding agreement in place for a number of years for the real-time collection of water levels in the Aquifer. On June 7th, 2022, the Calvert County Board of County Commissioners directed the Water and Sewer Department to provide a presentation showing the last 3 years regarding the Aquifer and to plan a work session on USGS. Discussion. Jeff Raffensperger, PhD, hydrologist for the Northeast region of USGS, is present to discuss the hydrogeology and groundwater resources of Calvert County. Mr. Raffensperger has worked for the Maryland, Delaware, DC Water Science Center in Baltimore since 1999. He's led or collaborated on studies of hydrologic processes, water quality, and modeling. The Water and Sewer Department and USGS will inform the VOCC and citizens of Calvert County on the past, present, recent, and future conditions of all Calvert County water aquifers, not just the Aquia, on October 18 today. And I'll turn it over to Mr. Raffensperger.
Does this control the slides? Well, good morning. Thanks for inviting me back. I was here 3 years ago, and I spoke at length really about sort of hydrogeology and the mechanics of how aquifers work. I'm going to sort of skip that and just give you an overview of what's changed in 3 years. Groundwater moves slowly, but there have been some changes. So I get the first, I can do it, right? So I'll do a brief overview of coastal plain hydrogeology, go through the aquifers. The Aquia, of course, is a critical one for you all, but there's been some changes over the last few years. And then I'll present some data on the withdrawals, the groundwater level monitoring, not only that the county provides funds for, but that other agencies and groups, including USGS, provide funding for. And then we'll look at some changes in those water levels and potentiometric surfaces. So the coastal plain is this thick pile of sediments. We think of them conceptually in terms of sand silts, clays, gravels, and split them into things that we can get water from, like aquifers, and things we can't get water from. The thickness goes towards zero, towards the fall zone or the fall line, which is sort of the Route 95 corridor between DC and Baltimore. It's about 7,000 feet thick at Ocean City. So it's actually thinner. If you looked at this to scale, it's incredibly thin, but it's an incredibly important resource, not just for Calvert County, but most of the Maryland, Eastern Shore, and Delaware. And as part of the North Atlantic coastal plain system, it's very important from Long Island to Georgia. So going through these, and I'm going to go from the deepest up to the most shallow, the upper and lower Patapsco exist below 800 feet below land surface in Calvert County. There's not a lot of information because it's fairly deep, but there's significant supply capacity available, and that's been known for a while. And one of the things you'll see through this talk is Calvert County is beginning to use the lower Patapsco increasingly. Above that's the Magathie, which is not a big player in Calvert County. I'm from Annapolis, and in our area, that's where people are drawing their water from. Then, of course, the biggest provider for groundwater for Calvert County is the Aquia, which is a regionally extensive aquifer, heavily used. And that's the one that we know there were significant declines in water levels from 1970 up to about 2000, right? As we continue to withdraw water from these wells, it's not getting replenished at that rate. We're impacting the energy of the water in those wells, and the water levels decline, which can lead to not so much dewatering of the aquifers, but it makes it less energy efficient to draw the water. So there has been some shifting of a portion of the public supply withdrawals from the Aquia to the Patapsco. And I think that was written 3 years ago that it could result, and it probably has. Then the Nanjemoy Piney Point isn't heavily used, I guess I would say, in Calvert County. So this is the same figure from 3 years ago, but I think we checked and it hasn't really been significantly revised. These are the public supply production wells in Calvert. You can note, the biggest thing to note is they're almost all the Aquia, right? That's your heaviest supply aquifer. Okay, so I'll show this a few different ways because it's hard to look at this much information. So these are withdrawals, excluding domestic, because it's really just the stuff that we have an appropriation permit for from MDE, which means more than 10,000 gallons per day. So in million gallons per day, most of those really tall bars are the Aquia, and you can see the increase from 1980 is the far left, up through about 2000, 2005. Very dramatic increase in use as the county and most of southern Maryland was growing. It's leveled off and even declined in the Aquia since then. So let me show the same data a little different way. In this case, they're stacked instead of side by side. And what you're seeing in the last 5 years is the increase from the lower Patapsco. Those are the orange bits of the bars on the right. So Aquia use is declining, largely in response to the fact that you had large declines in water levels throughout the Aquia. And of course, the county has to work with MDE. They're the regulatory agency responsible for appropriations. And I know they probably had conversations that said, you should look at maybe something other than the Aquia. In a little bit different way, just to try to highlight the increasing role of lower Patapsco. Behind over here. Okay. So there's a lot of monitoring going on. Of course, the county funds 4 continuous real-time wells. Those wells have been funded for decades now, I think, that stretch the length of the county. They're all available real-time. But we also have a number of other observation wells that may be monitored monthly, annually, or semi-annually. And all of that data goes into us understanding what's happening in southern Maryland and Calvert County, and leads to the formation of these potentiometric surface maps that I'll show at the end. So there's a lot of monitoring going on. So these are hydrographs. The axis typically runs from early 80s up to the present, so this is up through the present. Some of this data is not even fully approved yet because we're just at the beginning of a new water year. And the y-axis is 100 to 130 feet. So for one well, CABB 27, it's in the Aquia near Dunkirk. You can see those declines that covered about the same time period as the increasing withdrawals from the Aquia, right? As you continue to withdraw, you lower the heads in that aquifer. But as that leveled off, the withdrawals from the Aquia, so too did those declines in water levels. And it's been fairly constant since the mid-2000s. And it's even showing some recovery. So, aquifers can work this way. We think of them conceptually and model them mechanistically as being elastic. So if you stop pumping, you will see some recovery. And you can see it, there's another CADB 47, is an Aquia well near near us.
So is the recovery statistically significant?
We haven't gotten to the point where we do any sort of a trend analysis on this. It's fairly unusual to do, I think, for water levels. But you could probably do something simple to indicate that it probably is important. But whether I could say it was statistically significant, I don't think so. The fact that there's consistency there. So you can see there's always an intra-annual variation if you look at the well on the left. But the overall pattern is going up. If that intra-annual variation was much greater than the increase or the recovery that we've seen, then you might wonder, are we really seeing recovery? But we're pretty confident that there's some recovery. And I think there's a couple others that even show it. Well, no, this one doesn't. So this is the Calvert Cliffs. So again, since the mid-2000s, it's sort of leveled out. You're not really seeing recovery there, though, yet. We'll look at the potentiometric surface maps. That may give you a better indication. I just show the one on the right because it's I think it's one of the 4 real-time wells. And it's not showing much because that's a very short record, right? That only goes to 2006, which is about when the leveling off started to occur. A little different well that's not one of the continuous real-time is at Aquia, and again shows the same pattern. A significant decline in water levels from 70s to mid-2000s and now leveling off. Okay. So MGS and USGS produce potentiometric surface maps every 2 years. They're published and online. All these publications are part of this presentation that you all have, if you wanted to look at them. Potentiometric surface maps are sort of like topographic maps, but instead of land surface elevation, it's the elevation of that potentiometric surface of the water levels in wells. If you put a whole lot of holes in and measured all the water levels in the wells and contoured them, you get a potentiometric surface map. So I'm going to do this a little differently. I think last time I just showed a variety of these, but what I'm going to do is go through starting with the lower aquifers, a comparison from the last time's data that I had, which is 2015, 3 years ago, through more currently, the 2019. And I will show some more close-ups so you can look at the county. But the bottom line is, for the lower Patapsco, you are seeing some subtle changes in Calvert County, but not dramatic. Upper Patapsco, same sort of thing. I'm expecting that the one sort of in western Calvert County that's showing a little bit of a depression might be one of the production wells that's gone online in the last few years. I'm not really sure where they are. But again, it's not dramatic changes. You see dramatic changes in other places. There's a lot going on in Charles County. Magathie, very little difference because it's not heavily used. And the Aquia. If you stare at these for a while, you can convince yourself that you're seeing some of that recovery. I mean, it's definitely there, but you'd have to look at it in a little more detail. And I think that's yeah, so here's the Aquia just focused on Calvert County. That cone of depression down south of Solomon's has actually decreased because that well's not as active or it's been discontinued. I don't really know. And in general, you're seeing some improvement. So overall, you've shifted withdrawals from the Aquia down to other aquifers. You're seeing an improvement in conditions in the Aquia, which sort of leads to the future. And I'll start with the bottom one. So it'll be interesting to follow now through time what happens in the lower Patapsco as you're pulling more water from it and less from the Aquia. You may start to see areas that are experiencing greater reductions in water levels. In the meantime, you can keep an eye on the Aquia and see if it continues to recover. That might lead to a future where, because it's probably less expensive to withdraw from the Aquia than the Patapsco aquifers, that you may rebalance that. Of course, that's subject to whatever MDE says is okay. Usually the problems when we talk about the coastal plain relate to land subsidence, so those large reductions in the water level mean there's more and more stress. The water pressure's not as decreasing. There's more and more stress on the aquifer material, and that can lead to subsidence. And we're pretty well aware that there's subsidence happening throughout the coastal plain of Chesapeake Bay.
What was that word you used?
Subsidence?
Yeah. What is that?
Land sinking.
Okay.
Sea level rise and saltwater intrusion go hand in hand with subsidence. So if the land's slowly sinking, sea level's rising, you start to experience saltwater intrusion. To me, the only issue would come to be if you had shallow near coastal wells that started to get overtopped during surge or during storms. That's happened up in Kent Island and other places. Most of your aquifer you're pulling from these deeper confined systems, and I don't expect anything to change dramatically over the next decades. That's the end of the presentation. You have questions?
You have a question?
I do?
Go ahead.
Okay. Everything here I saw is great information on quantity. What I didn't hear anything on was quality. And from, I hear different things about PFAS and it was touched on earlier. It's known that the U.S. Navy had, significant PFAS contaminations up around Chesapeake Beach, mid-Calvert, to the point where there's warnings for the amount of fish and crabs that you should eat in that area. How does that affect our groundwater? We're talking groundwater and aquifer here, but how does that affect us? And if there's, for example, I think you talked about saltwater intrusion through broken wells or something like that. The same, in theory, could happen with PFAS contaminated areas, correct?
Yeah, that's true. And of course, USGS, like a lot of their agencies, are right on PFAS and PFAS, and there's a lot of analyses going on. I guess for this talk, I was really focused on the producing confined deeper aquifers. As soon as you get up to the shallower system, first, the aquifers work differently. They're not confined. You've got a water table, and they're subject to whatever's infiltrating. They're much more subject to climate change response, and so there's a national climate response network of wells that are 15, 20, 30 feet thick, and they're looking at those sort of issues. Those could also be used to start looking at geochemical impacts. And it's not just, we know there's Aquia has some arsenic issues.
Right, that was going to be my next one.
Yeah, those things are still there. And I think the original version of this talk from 3 years ago, I spent a little more time on that. I guess I would encourage you, if that's something you're interested in hearing about, that you contact Maryland Geological Survey. So USGS, we do a lot of geochemical sampling and analysis, but it tends to be regional or national. Maryland Geological Survey are much more aware of what's happening in the geochemistry of these aquifers and publish much more papers on it. So if that's something of interest, you may want to reach out to them.
Yeah, because from what I understand, the lower the water levels go in the aquifer, the arsenic is further down in the water. It's heavier. And so the lower you go, the closer you get to it and the more dense it becomes.
Yeah, and arsenic and a lot of things like that, it's sort of like the iron problem and the magnetite are redox dependent. So if the redox conditions in the aquifer change as a result of human use, then that can impact mobility of those things too.
So I don't know if you know off the top of your head that Aquia Aquifer, how many square surface miles does that provide water to? Do you know?
How many what?
Square mile surface area does that provide?
Oh, I don't know, but we know it's so all of these either pinch out or outcrop along the fall zone. So you've got from the 95 corridor, and they eventually all make their way out to the ocean, but they're at such depth as they go under that nobody's accessing them, right? So the extent of the access would be at least, so I would say southern Maryland. The Aquia is definitely used as a supply aquifer through all the southern Maryland counties and even part of the eastern shore.
The point I'm trying to get to is that, we hear about land withdrawal and concern about levels in the aquifers, and it's an issue that, it's a regional issue. It's not, in Calvert County, we're not gonna fix that. The good news is that the levels are maybe recovering, and at least they're not still declining, so.
I can go back. Yeah, there's several things. First, it brings up, I don't want to talk too long about this. There was a long effort beginning about 2004 through about 2017 that USGS, MGS, MDE, DENREC, lots of agencies were part of to try to develop an overall water supply study for the entire coastal plain. We had big plans to build mod flow models and do all this work. We had earmarks in congressional budgets for the state to do some of this work. Some things got done, but it didn't get completed. But this issue gets raised all the time. And it's difficult, because we did start looking to counties and to try to combine and work on getting that work done. But it's very expensive, it's very time consuming, we had long plans. There are models out there that are beyond just a single county, but they're not really comprehensive. On the other end of the spectrum, there is a North Atlantic coastal plain mod flow model that's very coarse, so it's not going to be great for addressing local issues. But yeah, these are cross-jurisdictional questions. The thing I was going to go back to is it not only is, and we see this throughout the country in some, really, not only are you seeing some recoveries because you're using less water, I'm pretty sure Calvert County's population's grown since 2000, but you're not using more water. So there's definitely some conservation issues and things happening and efficiencies being gained. That skyrocketing that was happening before isn't happening, and that's happening everywhere. If you look, USGS produces reports for the entire nation every 5 years, and that's across the board. We've just gotten more conservative and more efficient.
In the grand scheme, in the global aspect, it's my understanding that we're in a sealed system. There's the same amount of water has been on the planet today as it was 1,000 years ago. Is that correct? It's just in different places.
That's a whole, I'll go sure, yes.
Okay.
'Cause that's a whole nother
Right.
conversation.
But I guess that was a preface to, we see certain areas that are in droughts right now, and we see where our aquifers have gone down. Where'd the water go? I mean, is it just in other regions? It had to go somewhere.
Sure. Well, if we're in drought, then it's either going very, very deep into aquifer systems, it's discharging to coastal waters, or it's back into the atmosphere, and the atmospheric circulation goes over back to the oceans. So it could just be that continental landmass to ocean mass circulation going on. It's a
Gotcha.
good plug. USGS just published a new water cycle diagram, literally 2 days ago, I think. So you can take a look at that. You don't have to. But yeah, it's a good question. And drought is raising its ugly head again. We haven't started talking about it in Maryland, but it's sort of creeping its way east.
We've been very lucky the last 3, 4, 5 years.
Yeah. No, I started with the survey in 99, and of course, that was 99 through 01, that's all we talked about. Those are some pretty rough years.
Well, the good
Now we
news is
Now we mostly talk about storm surges and hurricanes and floods and
sea level rise.
sea level rise. Yeah.
So we should try to schedule MGS to come in to talk about water quality, since that's not information he collects, because that is important.
Yeah, they're gonna be much more knowledgeable about what's happening geochemically in the aquifers locally.
Yeah. So we try to schedule them in, talk about how good the water is. So, well, thank you. We appreciate your
Thank you. Sure.
presentation.
No, I'm
Appreciate
glad to
it.
be here.
Yeah.
Call me in 3 years, I'll be retired though.
But no use calling you in 3 years. But thank you for your time.
Sure.
So the next item on the agenda is a present work session with Department of Planning and Zoning. Morning.
Good morning, Commissioners. Mary Beth Cook, Director of Planning and Zoning. With me is Jessica Gaetano. She is going to be doing the presentation on the Consolidated Transportation Tour, which will happen next week with Secretary Ports from the Maryland Department of Transportation. We just wanted to come have a discussion with you so that you can prepare any questions, comments in anticipation of that. So Jessica?
Good morning, Commissioners.
Morning.
Jessica Gaetano, Planner 2 with the Department of Planning and Zoning. As Mary Beth said, I'm just here this morning to give a overview of the draft fiscal year 23 to 28 Consolidated Transportation Program Tour. Just to go over what the Consolidated Transportation Tour is, it's the Maryland 6-year capital budget for transportation and infrastructure projects, which includes major and minor transportation projects for the Maryland Department of Transportation, or MDOT's multimodal transportation business units. Those business units include State Highway Administration, Maryland Transit Administration, Motor Vehicle Administration, Maryland Aviation Administration, Maryland Port Administration, and Maryland Transportation Authority. So each spring, local jurisdictions are encouraged to submit priority transportation letters to the state, and then in the fall, the secretary and the heads of those business units meet with local jurisdictions to go over highlights of the draft CTP, and they usually will present some of their new initiatives and welcome questions and comments after their presentation. And to go over what we had asked for this past spring in our letter for the highway category. Of course, we asked for some assistance for the Governor Thomas Johnson Bridge and Maryland 4. Our second priority was Maryland 2-4, phases 3A and 3B, which would just be the finishing of the widening at Route 4, just north of Fox Run, and Maryland 231 corridor improvements. In the system preservation and highway safety category, we included, again, Maryland 231 corridor, Maryland 4 in Anne Arundel County, asking for safety enhancements along the corridor just north of the Calvert County line, and Maryland 261 at Beach Drive, asking for some site distance improvements. And for the transit category, we were asking for assistance in service and route expansions and a transit transfer station. And then finally, through the Community Safety and Enhancement Program, we continued to request continued assistance for sidewalk upgrades for safe routes to school. The town of Chesapeake Beach is asking SHA to consider more options to improve safety at the Richfield Station intersection, and we had asked for assistance to fill in some gaps between completed developments along Rousby Hall Road and H.G. Truman Road. So let's get into what we got on this CTP tour. And I did include some confetti because we're going to celebrate the little things. So this first one is a study to upgrade Maryland 4 between Maryland 2 and Maryland 235. A little background on this first project. This past spring, $1 million was earmarked by congressional funding. And then in this draft CTP, an additional $1 million is allocated to those efforts through the Primary Development and Evaluation Program from the State Highway Administration for a total of wait for it, 2 million in all.
And what are we gonna do with $2 million?
They will be here next week to answer that question for you.
When they told us it would cost $5 million just to put a fence up to keep the jumpers from jumping.
right.
So $2 million won't fill potholes on the bridge.
I wouldn't think so. I was actually in a meeting recently that they are doing a study about the suicide prevention for the current bridge, which should be coming out in the next few months. So,
Good, that's more than they told us.
so the minor programs, project program, excuse me, is probably what we're most excited for. Calvert is to receive funding for resurfacing and road rehabilitation projects at various locations throughout the county, some of which have already started and is ongoing. We will receive funding for safety and spot improvements to improve multiple intersections on Maryland 231, specifically at 3 of the most concerning intersections along that corridor. And as you guys already know, Mount Harmony Road construction has already started for much-needed improvements in that area. We also received funding for sidewalk upgrades on Bayside Road for safe routes to schools. But wait, there's more. The CTP draft also includes funding for various replacements and maintenance equipment via the Systems Preservation Minor Projects Program. We received buses, upgraded dispatch software, and funding for a transportation station feasibility study. So, in conclusion, the CTP tour is scheduled for next Tuesday at 10 a.m. Secretary Ports and the representative of MDOT's business units will share this year's Consolidated Transportation Program, and we'll give you guys an opportunity to ask questions, voice priorities in person. But with that, is there any questions for me?
So, they've told us that they're gonna do the 231 projects. They're working on those.
Yes, they're in the budget.
They're in the budget. And those 3 projects are adding the lane, putting the turn lane in down to, on 231 down to Yardley Hills, right?
I believe that was one of them, yes.
And adding a 3rd lane at Adelina Road in 231.
Yes,
And
skipjack.
are they gonna be able to fix skipjack?
I sure hope so. It's definitely one of the priorities we've been asking for a couple
I
years
know
now.
they've got a lot of challenges there due to wetlands and
Yes,
stormwater ponds, but they're trying to work on that.
yes. And they've been coordinating with the Department of Public Works, so hopefully we'll be working together on that in the next year.
And hopefully they're gonna tell us what we can do with $2 million for the Thomas Johnson Bridge.
I sure hope so. We shall see.
That'll
Does,
be a test.
does the phase 3 and 4 of Route 24 in Prince Frederick include the synchronization of the lights?
I do believe so, yes.
So,
That's the best news I've heard all day.
I mentioned in staff, I got an email last week from State Highway, said that they're beginning the process to do that work. It's probably an 18 to 24-month project from start to finish, but they are gonna start the design now. So, and I didn't want to be greedy, but I did add in my reply back to him that we should also look at Dunkirk. We have 2 lights there. It would be very helpful if we could get those 2 lights working together. Because invariably, you go through Dunkirk, you're going to catch one or the other.
Agreed.
It's pretty hard to catch them both. So I don't want to be too pushy, but I'll remind Secretary Ports next week that we should even add that. It can't be that much more money.
Well, that's more than we've heard since, in the draft, it said that the phase, the widening is actually on hold, and we didn't receive any funding, so,
That's for the last phase at about north of Fox Run.
yes,
Yeah, they don't talk about that very often.
no.
No. So
But we won't need to widen it if we get those lights in.
if we can get those lights synced up, we believe that'll be a tremendous help.
Absolutely.
And while we haven't talked about Dunkirk, especially in Dunkirk. So I don't know that I have any other questions.
Appreciate it.
I think Commissioner Gadway next week is going to raise the issue of notice when they start the projects, so we can do a better job of, especially when you close a road, we have to make notifications for fire, rescue, police, resources to make sure that they've got alternative plans.
Agreed. Okay. And we'll be
So-
working with them after that conversation. I'm sure
Yeah,
we'll be working on that.
yeah. But I think we're probably good.
Thank
And
you.
I hope Secretary Port shows up.
He's supposed to be here.
He's supposed to
Yeah.
be here. We haven't heard otherwise.
Yeah.
Thank you.
You know, our challenge is going to be, just as a reminder to everyone out there, if, depending on how the general election turns out, if there is a change in administration, sometimes that creates hiccups in processes,
I'm very persistent.
projects.
I'll
and-
I'll
Yeah.
get some answers and we'll get the notice out.
Because you end up in a transition, and, you know, if they've started a project, generally there aren't hiccups, but if you got a project that's,
Funded but not proposed, or not
Exactly.
started, yeah.
exactly.
Absolutely.
We do have a Southern Maryland rep that's very good. So I just need to make sure that we're in contact more consistently. So,
Because those 231 projects are very important,
absolutely. Yep.
more so than probably the signal lights, but we don't want to tell them that.
Didn't hear anything.
Let's get both.
Well, thank you very much.
Thank you.
And have a good day. So the next item on the agenda is public comments.
Yes, sir. So the board adopted a resolution in 1989 intending to maintain the order and decorum of the governmental process, and a copy is found here to my right. The Ethics Commission has asked us that we remind speakers of public comment that lobbyists include those who seek to influence public policy, and lobbyists must register in advance. Floor has been open for public comment from persons in the meeting room, and if anybody joins us virtually, you may begin making your way to the microphone. All speakers are asked to identify themselves and whether speaking as an individual, where you'll be allocated 2 minutes, or as the designated representative of a group, where you'll be allocated 5 minutes.
Hi, my name is Scott Squires. I'm speaking as an individual. Can I come hand these to you guys? I made these for you guys. Over here. Only 3 are here, but maybe they can get it on the desk.
We will, thank you.
Again, I'm Scott Squires, speaking individual. So recently, guidance to the county on interacting with First Amendment auditors has been passed down throughout the county. And while the actions that we are instructed to take when encountering an auditor are 100% correct and agreeable, the context in the presentation surrounding it is a little bit concerning to me. The content of the presentation will only serve to plant a negative seed into all the county's employees' minds. This would inevitably cause only more problems in the future rather than create a neutral or hopefully even positive mentality around it, as I previously tried to elaborate to the county attorney, Mr. Norris. His response to me, in my opinion, was kind of dismissive, but also more so alarming to me, indicating that you all care more about the possible loss of money and insurance coverage over the most basic liberties of your own citizens. Last time I checked, the elected officials made the policies not LGIT or legit, however you want to pronounce it. As a matter of fact, I reached out to the presenter, Mr. Peter from Legit, who informed me that what was distributed was not even intended to be sent out as a countywide policy. Or guidance, I guess you could say. He even asked me for the talking points that I sent to Mr. Norris, which I sent him, and then for us to have further discussion so that my input could aid in his making of his actual hour-long instructional class that he plans on making. What this shows is not some nefarious intent to make the county employees hate citizens that are exercising their rights. That's not what I'm trying to say at all. But I feel it's kind of a laziness just adopting that policy without like checking, and the lack of ability to push back and ask questions instead of being just essentially a yes man to an insurance company. That laziness will allow the negativity to take root everywhere that presentation was sent, and it seems silly to me that a simple park ranger with no knowledge of who made it or what it looked could do a little due diligence and make a divisive issue known so they could make a more neutral product. Assuring that employees don't have to fear a guy coming in with a camera if and when they encounter it. And off of the topic of that, just now today, coming down, into the entrance, I had my own recording device, upon which I was told I'm not allowed to. But it's my understanding that there's the Maryland Open Meeting Act, which says I can. There says all these signs that say to silence devices, which everyone in here probably has devices on them and they're silenced, and a lot of them are using it. There's cameras there, that guy's a camera, so what is the issue with a guy coming in with another? That's pretty much all I have.
Thank you.
Thank you for your time.
Thank you.
Absolutely, thank you.
Thank you. Anyone else?
I have no news or no anything, don't worry. I'm Bob Estes, representing myself, and I was talking to them about recharge of aquifers out in the hallway, and you'll be happy to know that no matter what they do to our recharge zone, which is where the water comes from that gets to us, we don't have to worry because we'll be dead a couple of millennia by the time that water gets to us. They said the recharge, say they dumped a bucket of poison in the recharge zone, it doesn't get to us until thousands and thousands of years. I didn't know if you knew that, but it is kind of comforting, sort of. So, thanks.
Thank you.
Still no one online. Is there anyone else in the room?
Thank you. So at this time, we have commissioner reports. Commissioner McConkey?
Nothing, Mr. President.
Nothing. Commissioner Gadway?
Thank you, Mr. President. I took a look at, I'd like to encourage people out there, there's a great website, Maryland Workforce Exchange. I see that we have about 138,000 citizens across the state of Maryland that are currently unemployed, about 2,063 of which are in Calvert County. There's a lot of openings on Maryland Workforce Exchange. There's a lot of employers out there looking for people to come in and help pitch in, and we can definitely use people coming back to work. So if you're out there, if you're interested, upgrading, just getting back in, Maryland Workforce Exchange is a good opportunity to get into. Thank you.
Thank you. So on Saturday night, I attended the 100th anniversary of the Victoria Lodge in Huntingtown. Most of you probably don't know what that is. It's an organization of African-American men that charter was established in Calvert County in 1920. So because of COVID, technically it was the 102nd anniversary of the Victoria Lodge in Huntingtown, but they do a lot of great work in our community. During COVID, providing meals, transportation, just a great nonprofit organization, religious-based, that serves our community and makes it a better place. So it was quite interesting that night to hear the presenters talk about the different things that they do. And any organization that survives 100 years, that's quite an accomplishment. When you think back since 1920, all the events that have happened in this country, and that this organization has survived through all of those, it's quite a testament to all those individuals that serve. So it was quite enlightening, and as I tell people, that was the fanciest event I've been to in probably the last 10 years. That group knows how to put on an event. I did wear a coat and tie, but I was very underdressed. I should have rented a tux. Was at the Holiday Inn in Solomon's, probably one of the last events. We're told that's going to close sometime in October. I've never seen the Holiday Inn decorated as it was that night. So it was quite an event, and I want to congratulate them on all their years of existence. On Sunday, I attended a dedication of a gazebo at the Dialysis Center on West Stairs Beach Road. Recently, you heard us talk about the passing of Mr. Jack Hammett. Mr. Hammett built that building for them, now I've forgotten how old it is, and was leasing it to them for a long time, and had the foresight a year or so ago to tell them that they needed to buy it. And at the time, they said they didn't quite understand that. They sort of like being renters, but now with his passing, they understand why that was an important thing to do. That he was willing to sell them that building that they are in, along with the building beside it, that now they rent out and generate some revenue for them. So they have a little gazebo there. If you're ever there, they're going to put a sign up dedicating that to Mr. Hammett and to a name I can't remember right now, the doctor that started that facility there. So it was a very nice little ceremony, but just another recognition of a Calvert County citizen doing great work for our community. And that's all I have. So somebody's got to make a motion since Commissioner Weems isn't here.
To make a motion to recess to executive session pursuant to 3-305B1I to discuss the appointment or removal of an appointee and to discuss a discipline and/or removal of an employee over whom the board has jurisdiction.
Second.
I have a motion and a second that we go into executive session. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries. You all have a great day.